Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, here from the JWC studio, and today is a special episode on multiple levels. Today is our 50th episode. We've been doing this for a long time now, and the second reason why today is a lovely episode is I've got the ever fantastic Lale Busheri here today.
Thank you for having me.
Lale, thank you so much for being here. As I said, it's a 50th episode, which is a special occasion for us. But I have to tell you, it's a special occasion because we had this plan to be one of our first guests actually here on this podcast when we just started 50 episodes ago. And unfortunately, you had a health incident and couldn't do it at that time. But it's actually a nice thing because it's come a full circle and we see you looking extremely healthy here today and completely fit and ready to go. So thank you so much for being here.
Thank you.
Gone on to a little bit of a tangent about 50 episodes, but let's start with you. You are a pioneer in the breast care space. You are the CEO of Prashanti. You are a TEDx speaker. You are a pioneer and thought leader in this space of, breast cancer and cancer generally. So I can't think of the right word that best describes you. Maybe you can do that at some point. So let me just straight ask you, because it's such a big topic. We're both wearing the right colors for breast cancer, and that's what we want to be talking about primarily today. So the first question that I thought I'd ask you is that what is it that comes to your mind when someone says breast cancer?
The best cancer, BST.
The best cancer?
Breast cancer is known as the best cancer,
Okay.
BST, because if picked up early, in early stages, right up to stage 3, is completely curable.
I see.
So it's known as the best cancer. That's what comes to my mind.
That's it. That's not an answer I would have expected. So that's actually a nice way to start. But then coming back to that point, why is it the best cancer? Is it something that is just because of just awareness that one can detect early, and what are the methods that one should be adopting at home just simply to be able to do that?
Lovely question, Kavas. It's known as the best cancer because if picked up early, it's completely curable. And there are many things you can do. I always encourage the men and women that to listen to your body. Your body will first give you signs and symptoms. So one of the earliest, and I say that to the men also because even men get breast cancer.
Yeah.
Although it's very rare, it's 1 out of a lakh. And normally it is when there's a BRCA gene in the family. That's when you'll find
What is it for
cancer.
women if you say it's 1 out of a lakh for men?
It's, I think, 1 out of 22.
Oh, so it's actually
Yes.
far more common.
Far more common. And there's a lot you can do to prevent breast cancer, to pick up an early cancer. The simplest thing a person can do is at home is to do a self-breast examination. So none of us are doctors or nurses.
Exactly,
so if we try to examine our body with the dry hand and a dry skin, you'll find your own breast tissue and get worried. So the best thing to do is to, in your shower, to soap yourself, not to use the fingertips and not to use the base of your hand, to use the flat of your palm and raise one hand up, say the left hand, and then rotate clockwise and anti-clockwise around your breast. When you have soaped yourself well, this hand will just glide. And it will be like finding a marble in the bag of rice. You cannot miss it.
Okay.
Like-
so you're looking for a lump.
You're looking for a lump.
So to
That's the
speak.
easiest way.
Right.
And then you left your right hand up in the same way, clockwise and anti-clockwise with your left hand. And the hand just glides and you'll feel the lump if there is a lump. Then you slightly squeeze your nipple. If
Right.
there's a clear water discharge or there's a bloody discharge, is one of the first signs mostly of breast cancer.
And all that is typically early signs.
Very early signs. And if you have a white discharge, a yellow discharge, a green discharge, or anything else, or a milk discharge, they are infections. So you can address that differently.
Yeah.
But if you find blood or this coming out, you should address a doctor. And also, no two breasts are equal on birth.
Yeah.
So you should know your body. And after you had a bath, when you wipe yourself, look at yourself in the mirror by putting both your hands up. And if you find one breast going lower than the other, you need to address it.
Okay.
Or if you find a nipple getting introverted. Now, some people are born with introverted nipples normally.
That
So that
means
is
they're
different.
sort of
It's
pointing
inverted.
inside, right?
Yeah. But if it's not and it's inverted, or you find a rash on your breast, or you find a lump or anything else, you need to address the doctor. That's the easiest way. And I also say that regularly, if you go to your health provider, your doctor, and you find out, depending on your age and depending on what your family history is, they will tell you what tests you need to do annually.
Right.
And that's when you can start very small by a clinical breast examination or a sonography. So you're not intimidated.
Like
And then-
screening.
Yeah, like a screening. And then you
Which a lot of
take it
people are
forward.
actually scared of.
They're very scared.
Use the right word, intimidate.
Yeah.
And why is that? Why-
They're
why-
mostly intimidated because, in the olden days, the mammograms,
Painful.
They compressed the breast and they were painful. Today it's not so. The mammograms are highly advanced and there's a tomosynthesis with it, which is the best mammography machine to use, a 3D with tomosynthesis.
So you're saying they're fairly pain-free today?
They're practically faint, just gives you a slight compression.
Okay.
And women after 40 have to have a mammogram. The ones below 40 have a clinical breast
How often?
examination once a year.
Once a year.
And otherwise, they have a clinical breast examination with a sonography. And of course, if you've had a family history of anyone below 50, the first relative in your family, like a mother, sister, or a child who below 50 has had a breast cancer or ovarian cancer or something, then you need to start your screening 10 years before they had it. So suppose
see, okay.
your sisters had it at 40 or 35,
right.
then you start at 25 or 30, depending on
Interesting. Okay.
Yeah.
That's a good sort
That's
of
when you start.
bit of advice to give
Yeah,
people
that's,
or to think about it.
Yes.
And then again, that's early screening.
That's very early screening, and you need a mammogram or a sonography depending on your age and a clinical breast examination, and you can pick it up very, very soon. And the 3D machine with tomosynthesis, which is also at Orchids at Jahangir, is one of the best machines in the city, and that picks up very, very early cancers because a machine without tomosynthesis will not pick
Okay.
up a very early tumor, which is
I
hidden in your
see.
breast
Okay,
tissue
right,
behind.
right.
But this will pick up, it gives layers of your breast.
Okay.
So we'll pick up the tiniest lesion hiding right behind the breast tissue, which is like probably not even stage 1, but stage 0.
So it's actually a good thing that it happens at
Very
that
good
stage,
thing.
versus
And Kavas, most people don't know there are 5 stages of breast cancer, not 4.
Hmm.
So stage 0 is a stage when a lump comes. It could become a cancer,
Right.
may not become a cancer. Until it comes to stage 1, there is a window period of 8 to 9 years.
that's a huge
Yes, there's a huge gap.
opportunity. Is actually
Absolutely,
yeah.
to pick it up, and then that is just a precancerous lesion, which may become a cancer or not.
Right.
And you can address it without chemotherapy, with no radiation, just a removal of the lump.
Which is why what you said, thing about self-examination, screening is, so important, and it can avoid so much
So much harsher treatment later on.
treatment,
Yes,
stress, everything.
yes. But the problem is that there's not that much awareness in our country.
How do we build that?
Build it by like these kind of having podcasts, talking, having screening camps, have articles in the newspaper.
Right.
And
And
I
what
think
Prashanti does.
we do at Prashanti, we run
Huge amount of outreach.
Yeah,
Can you
outreach.
talk about what you all do? It's
Yeah,
lovely
so
what you do.
Prashanti actually, congratulations for your 50th episode.
Yeah.
And this is 25 years of Prashanti.
Oh, lovely. I love
Yes.
that little coincidence that we
yes.
have that.
So it started 25 years ago when Anand, that's
Dr.
Dr.
Kopikar.
Kopikar, realized that people came to him who couldn't afford treatment, and he operated them free, but he couldn't help them with chemo, radiation, or anything. So over the years, Prashanti was formed to take care of people, to handhold them through the bewildering maze of challenges this disease has brought to its wake.
Right.
So now, over the years, not only for treatment, but we have a holistic wing. So we have genetic counseling, nutrition, yoga, and we have a support group, and now we have a research wing. So it's gone a long
Yeah,
way.
absolutely. And
Me-
I've been to so many events that, Prashanti have held, and now, of course, we're tied in
Yes, of
together
course,
as
absolutely.
partners. But regardless of that, I have to say that the things that I've attended for, it's hugely powerful. The stories that
Of these women.
of these women that that have come out, and how you all have
Yes.
really supported
Yes.
them and brought them through,
Yeah.
and now are striving in their lives. Any examples that come to mind that you'd like to share? Because I remember there's some really powerful ones that left me very
Yes,
impacted.
there is one girl, of course, who's deaf and dumb and blind, whom
Right.
they have taken care of, and she's been amazing. Her positivity.
Hmm.
And I think what touched me the most among the patients I have handheld is actually not a breast cancer patient.
Okay.
It's a boy who had blood cancer.
Okay, so it's not only breast cancer.
No,
that you
we
all
did all cancers first, and then we
Right.
narrowed down
Just
around
now.
2009 to breast cancer
Okay.
because it was too expensive to manage everyone with the costs going.
Yeah.
So we decided that we should not be able to turn a single person away from our door
Hmm.
and handhold everyone. But there was this boy whose father was no more, and he was a maid's son. And he was giving his exams, and he would come and take chemotherapy at our center. And his papers were every day at 3 o'clock. And I would
Right.
tell him, don't give the exams, give it next year. And he said no. And he would study and have his book on his lap. And I used to bring him mango milkshake every day because he liked mango milkshake. And we forgot about him after his exams were over and his chemo was over.
Okay.
One day he turns up, and he came first in Maharashtra. I'm in touch with him. He's become a chartered accountant.
Lovely.
And he's
That's
doing very
fantastic.
well.
That's it.
Yeah.
From-
And his mom is still a housemate.
But that's exactly what I meant by the kind of impactful
So I think,
stories.
Kavas, in our country, getting diagnosis of cancer is a life-changing episode because, the first thing you think with cancer, you think of mortality.
Exactly.
Morbidity, mortality. And if the poor don't have the funds, then where do they go? They don't even know, don't have a chance to start. So that's
Absolutely
a big...
And an offshoot to actually what you're saying, when someone gets the diagnosis of cancer, especially if we're talking about breasts, there's always that fear of, no, not myth, but there is a fear that the moment someone gives you that diagnosis that I'm going to lose my breast.
That's
What are
a
your
very,
thoughts on
very
that?
big myth in India, and in a way, it has been rightfully so over the years. Because over the years in India, about 95% of the centers mastectomize the woman left her without a breast. And now there are enough studies and papers to show that mastectomy is not the way forward because it leads to depression, sexuality problems,
Right.
body image, the shoulders start drooping, backaches, and
Yeah,
all that.
yeah.
So we realized that many years ago, in I think about 2015, we started doing a training program for oncoplasty, and it's linked with Jahangir, of course, and
Right.
I started training doctors. So we've trained now over 1,000 doctors in India to do oncoplasty. Oncoplasty means onco means cancer, and
Yeah.
plasty means the cosmetic part. So
Okay.
removal of the cancer at the same time creating a better looking breast than she went in.
Okay.
So most of the women
So
go in
like you're-
after 40.
So you're
and she's
combining
sagging.
plastic surgery
absolutely,
with
absolutely.
the benefit
Yes.
of
And now
treatment
we
of
find
cancer.
that in India, after the training of more than 1,000 doctors, the mastectomy rate has come down to
Okay.
65.
Wow.
So that is the way forward. Actually,
Right.
no woman should be mastectomized unless there's no choice.
Right, right.
And she should have the choice to have oncoplasty and have a. So it entails only a one-night stay in the hospital.
Okay.
The next day she goes home. Normally the incision is from below the breast or under the arm or around the areola, which normally goes away in a couple of months.
Right.
So there's no mark on the breast, and the breasts are also lifted. So she looks better, she feels better after the surgery.
That's fantastic. That
Yeah. That is the gold standard of treatment all over the world.
on how it's developed now,
Yes,
which
that's the
actually
gold
comes
standard.
to that is the gold standard.
It is the gold standard.
and that's something that
all
we're
over
doing
the
here.
world. Yeah, we're
It's
doing
common.
here. It's not common. I think we have it at our place here,
Right.
Jahangir.
No, I mean, it's
So
common for people that
it's,
come to our center.
They come
at
from all
Jahangir.
over the country. They come now
Right.
for just oncoplasty. They come from all over the world. They come from all over the country now too.
Yeah. No, the point I was making is that it's common for people to do that when they come to us. It's not like a rare thing.
No, it's normal. It's,
yeah, I was just saying it's become
it's
the
a
norm.
gold standard for us.
Right.
Also, in the olden days, the doctors were not trained carvers, so they never offered it to the patients,
Mm-hmm.
and the patients were not aware, so they never demanded it from their doctor.
Yeah.
So it was a lose-lose situation on both sides.
Right, right.
But now the doctors are trained and the patients are demanding.
And we're seeing the treatment and technology and all that getting advanced and advanced. How have you seen that development? Where would you like to see that development go?
See, personally, I've seen it on many fronts. One, of course, the surgery part where a woman is not left mastectomized. Her
That's
breasts are-
so actually that's an offshoot question I was going to ask you or thought about asking you while I asked my first question is what is the biggest change that you've seen in treatment that has been so positive? Is it this?
Yeah, I think the oncoplasty is the biggest change.
Really?
Because it doesn't let a woman get scared. She comes in for treatment. She's not left without a breast.
Yeah.
Because her sexuality, her self-image, her
Right,
body
right.
image, everything is in question. And the other thing is, of course, with chemotherapy, also the drugs have got much smoother. There are a lot of side effects still, but the drugs are much, much smoother. We at our center never see any nausea.
Okay.
So earlier there was a lot of nausea. And
Yeah,
now in
yeah.
many kinds of breast cancer subtypes, you don't lose your hair. And you have the cooling cap. So in many of them, you don't lose your hair.
Right, yeah.
So that is another thing. And radiation also is very
I should
targeted.
probably get that regardless.
You know,
One day.
Anand, when the girls are not willing to go for chemotherapy and he's counseling them for an hour and then he's exhausted, because the only thing that disturbs a girl, I find, is that she's going to lose her hair.
Right, right.
She's not worried about the treatment. Then he says, see, mine is not coming back, yours is. And they laugh and they go in.
Yeah, that's what I'm saying. Maybe both he and I should start wearing them regardless.
So, and then of course, radiation is more targeted today.
Yeah.
And what we have, of course, is holistic, which I think is wonderful at the center with the tie in the marriage between Prashanti and Jahangir,
right.
is that we have free counseling for the patient, free genetic counseling, free nutrition, and we have the support group that gives, there's yoga and so many other supportive.
And that's exactly,
elements.
I'm so happy that you mentioned that because as you said, it's holistic.
It's
not
completely
just
holistic. No,
one aspect
not
of it,
at all.
which is of
It's
course, I mean, what we're trying to focus on here from the
Yes.
wellness standpoint,
Yeah.
but even from a treatment standpoint,
it
has
is
to
all
be
about, it
holistic.
has to be of the mind, body, the soul, everything.
Absolutely.
It has
The
to.
mind is, there must be, and you've seen this probably in far many,
Totally.
in so many patients
think-
that the mindset is probably one of the
most
largest
important
factors.
It is
that
the most
contribute
important
to
thing
this.
that makes her heal and recover and not get a relapse.
Right,
The positivity and hope.
Yeah. So coming back to the treatment side, one thing I didn't mention also from the long list of things that you've done is that you've actually written some fantastic books as well.
Yeah.
One even being in gene therapy and gene testing, which is quite something to be writing about. Not being a doctor yourself, but that's
Yeah, but I realized that most girls didn't know anything about
Yeah,
it when
exactly.
they came. They were clueless, and especially in India.
Right.
Even the educated or the older people were completely clueless. Everyone, I think the biggest myth I found was that everyone thought if there's a family history of breast cancer, I'm going to get cancer. It's not so. Or also, if I do the gene test and I have a mutation, I'm going to get the cancer. No. It's just that you're at higher risk
Right.
of getting the breast cancer. So you need to be under surveillance. So, for example, instead of having a mammogram or a sonography once a year, your doctor may ask you to come in every 6 months.
Yeah.
That they're on top of things. It doesn't mean that you will get it. I just finished writing my third book.
that's going to be my next question. What is your next book? Are you allowed to
It's-
tell us?
I think it's the most interesting. It's
Oh, really?
be out in about 2 months. It's about for the caregiver.
Oh,
So I found that in now in India it's more of a nuclear family instead of an extended family,
Right,
and
right,
the
right.
primary and the secondary caregiver, the husband or the mother or the
Right,
daughter,
right.
is the one who's completely devastated and doesn't know where to start, where to finish.
and the burden is so high on
Very,
them.
very high. So it's like a Bible. It's hand holding the caregiver through the whole challenges that this disease and the protocols bring, and helping them prepare much before something is happening.
That's why it's
It is
so
hand
important what
holding.
you do, because it's just so much far beyond just the medical.
Completely. I
Side
think the
that really
medical
makes
part
it
is only
work.
half of it, and the other
Absolutely.
half is the support. You know?
And that makes such a huge difference. So
That made me start in the support group in 2009.
the
Pink
pink ribbon.
Support group.
Tell us about that.
Okay, so I realized that, this is not a journey you can walk alone. It's impossible. You have to have support. So in 2009, I started the Pink Ribbon Support Group, and we made it area-wise. So we have now over 5,000 members in Pune.
Okay.
And it's area-wise. So, for example, if a girl from Koregaon Park comes, a young girl, or from Baner, and she's got breast cancer, we put her into the group of that area. So they handhold her completely.
Okay.
They send food to her house. They make a table, and somebody will send food to her house. Somebody will take a child for a movie. Someone for a play date. Somebody will take her for chemotherapy. At least one of the patients will talk to her every night to calm her down. And, it becomes a platform for them to share all their fears. It becomes a platform for them to understand that I'm not alone. Everybody's gone through this journey. Some have gone through worse, and I'm going to get out of it. And basically, it gives them resilience and gives them strength to go through the whole.
Yeah, there's such a big support system.
Yeah, it's
for
a
it,
huge,
to
and
know
we are
that
very
someone
close.
has gone through it.
Now, over these 17, 18 years, some fabulous friendships have come out of the
I can
support
imagine.
group. People have got well, they are, they've moved on, they've got married, they've had children, but their second generation now are friends with the other person.
Exactly, and that just builds on itself. The network
Fabulous. So
effect.
we meet every month. We meet every month and we do fun act. We have picnics, we have yoga sessions, we have at my home, we have evening teas, we do lots of
Okay.
stuff every
And if someone wants to get in touch, how do they do that?
They can just let me know, we add you in. And so we have a lot of caregivers. We actually have patients, people now who are not patients,
Okay.
who just want to be a part of the support
Yeah,
group
yeah.
to give in, and they're there. And we have a lot of men who are there now in the support group.
Oh,
It's very
that's
interesting.
good.
Yeah, very good. And they're very active.
Yeah,
So it's nice.
that's lovely. It's amazing how.
Because it's not a journey you can go through alone. You need that support.
Yeah, so what's the phrase? You need it takes a village to raise a
Yes,
child,
right.
but in this case, I suppose you need a
Yes.
village to save a
The
child.
whole community,
Yeah,
Yeah.
which is so lovely that.
You get strength from that.
But coming back to the gene testing part, because that's a interesting one. Is that something that's easily accessible today for Indians?
Yeah, it's very easily accessible, and it's just a blood test. It
Okay.
takes about 3 weeks to let you know whether you have the mutation.
Yeah.
And of course, having the mutation doesn't mean that you're going to
That's
get
what you were
cancer.
talking about, so.
The doctor will just put you on to surveillance from a little earlier age. So basically, either a sonography if you're very young, and a clinical examination, or a mammography much earlier than the required time. And you're just handheld through that to see that there's no issue, and if there is an issue tomorrow, it's picked up so early
Yeah,
that you
exactly.
don't need
And
to.
that ties in so well with what we were talking about
Yes.
earlier with screening and
Screening.
stuff like that.
Screening.
If we can combine all these preventive
Yeah,
measures, you're sitting on a good wicket really.
If a woman is asymptomatic, means she doesn't have breast cancer and she doesn't have a family history, guidelines don't require her to go and have a genetic test.
Okay.
But sometimes they want to have it, so they can.
Yeah.
But if you've had a breast cancer, or even if you do not have a family history, sometimes doing the genetic test helps you get a better protocol and a better guideline for your whole treatment.
Okay. That's quite, yeah. So, but can I, where does one go to do this? Can you do this
If
anywhere?
they come to Jahangir,
Oh, yeah?
blood test,
What
at
else?
center at our center in Jahangir at Orchids, yeah.
What
They
else
come,
do
it
we
takes
do
to,
there?
we do everything there.
Yeah.
So we have the holistic part there. We have regular counseling, we have bereavement counseling, we have genetic counseling, we have nutrition, And it's completely free covers.
Right.
So you're handhold through the entire treatment, what to eat, what not to eat, when to do what, even the counseling for yourself, for your family, for your loved ones, primary, secondary caregivers.
Fantastic.
Any amount of sessions are completely free.
Really? Any?
Yeah,
Oh, that's
any amount of
great.
sessions. It's completely complimentary.
Okay.
And so we have that service from Prashanti, which we have put into a marriage with Jahangir.
Right, right.
And from Prashanti, we have them sitting every day. And it's done at Orchids. And of course, we have Oncoplasty there, which is probably the only I think Anand and the unit at Orchids at Jahangir is the only standalone unit to have the largest number of oncoplastic cases in the country.
Oh, really?
Yes.
Oh, wow.
The largest number in the country. If I may, it would probably, if I haven't done it, it will probably be Asia. But definitely for India, we have the largest number of oncoplastic cases in the country.
That's
Single
incredible.
standalone unit and a single surgeon.
And to do it at such a holistic level.
Yeah, at a holistic level.
Right. That's quite something.
Yeah. Then also, which is very important, we, even when the caregivers come, we kind of counsel them for early signs of picking up breast cancer for themselves. The very simple things like a discharge from the nipple or a rash on your breast,
Right,
or the
right,
nipple getting inverted, or there is a kind of a change in the skin color. So we also guide them. We also teach the caregivers and the other family members how to do a self-breast examination. We handhold them right through the entire process.
Yeah, and again, it comes back to that awareness.
It's
that
all
we
about
just need to
awareness.
Keep
It's-
pushing out.
I
And
think it's
again,
awareness
so
for
simple.
it's very, very simple. But we don't have it in our country. And as a human being, we brush anything under the
Yeah,
carpet.
yeah.
The body tells you all the signs.
Yeah, right.
All our bodies, we feel tired, we feel lethargic, we find inflammation, we find so many things. But
Right,
we always
right.
say, oh, we've traveled and come, we've had late nights, we haven't slept well. And now scientifically, we know that sleep plays a very important part.
Huge part.
Yeah. So ideally, you should be getting 7 to 8 hours of quality sleep.
Right, right.
About 6 hours and below is a high risk for diabetes, blood pressure,
Hmm.
hypertension, all that. And above 9 hours again doubles the risk for other diseases.
9 hours?
Yeah, above 9 hours you shouldn't be sleeping.
Really?
Yes.
Should tell some sleepy heads about that.
Yeah. And above 9 hours. And they say your afternoon nap also should not be more than 20 minutes.
Yeah, that one is.
Yeah, it should not
is
be more than
important.
20 minutes.
Actually, I do that, and actually, it makes a big difference to my
makes it-
day.
yeah,
It's actually
it just kind of makes you
energizes
fresh.
you. Absolutely right.
Yeah.
But-
And of course, lifestyle, your exercise is very
Yeah,
important, about
absolutely.
45 minutes. And stress, you have to, there's not possible if anyone says I don't have stress.
Again,
We
it
all have
comes back to
stress.
that holistic
Moment you wake
wellness
Yeah. So,
from-
but how do you manage their stress? That part is important.
How do you manage your stress? Because you handle so many things.
I think for me, gratitude.
Oh, that's nice. I like that.
Immense gratitude.
Right.
I always see my glass half full.
Really.
Because I always feel that so many people around me who are in a worse situation, and we're so blessed, all of us.
Absolutely.
To have so much, and we should be able to navigate through that.
Mm-hmm.
And also, I think my morning, about 15-20 minutes, I need to myself.
Okay.
That grounds me for the entire day. So whether you pray or you meditate, or you
Right,
just
right,
have some time to yourself.
But I really do love that answer of gratitude
Gratitude.
as being a simple stress
Shukar.
buster.
Every minute, just do gratitude. Every minute.
Oh, that's
So
great.
even when friends or patients tell me, I say, you know what, it could have been worse. Let it go.
Yeah, absolutely. That's such. It's a lovely way to just shift that mindset.
Yeah, the perspective shifts.
Yeah, exactly.
And also, Kavas, I think, apart from gratitude, you fight the big battles, not the small battles. So let the small things go all the time. It's not important.
Right.
So I always feel like 5 years later, when I look back and these things bothered me, were they important? No, they were not. It doesn't matter today, right?
Right.
So if you look at, will this bother you or matter 5 years from today in your life? Then probably address that.
Right.
And if they're not going to, let it go.
Okay. Well, looking forward then for maybe my last question then to you is that in 5 years' time, where would you like to see Prashanti Orchid's breast be?
So, Kavas, today there are approximately 180,000 new registered breast cancer cases in India. Registered. So the talukas
Often though, every year.
So the talukas, the villages don't have a good registry, as you know. So can you imagine the amount of new cases?
Right.
I hope through Prashanti and our center at Orchids, we are able to create a lot of awareness and save lives. And pick up very early cancers that girls are completely treated and they move on. And it's just like a little speed breaker, like a Pune speed breaker in their life. Just a little bump and it's
hopefully a
over.
little bit smaller than the
Pune speed breaker, and that we can create enough awareness to save lives. So often I give talks at the IT companies and all.
Right, right.
And nearly every month somebody comes up and said, we had this sign and we heard about the water discharge. And they come and they're very early and we're able to save those lives.
Exactly, and that's
So
really
I think this is what we can do together, create this awareness and pick up very, very early cancers in our country.
Yeah, I think that's the one thing that is sort of being the recurring theme from today's discussion, from what I'm taking away, is that it's just simple awareness.
It's very simple. And Kavas, it's very, very simple, because life is very precious. It's the most precious
Yeah.
thing. Till you have life, according to me, you have everything.
Right.
Moment life is gone, it's just over.
Gratitude.
Gratitude and to create an awareness to pick up an early. Every girl, every woman you're able to help pick up or do a clinical breast examination, or she can learn to do a self-breast examination, and she comes up early if there's a problem, is one life saved.
Absolutely. I don't think that's, I can't end on a better note than that. So, any last words that you'd like to leave us with? Any last thoughts?
I think find joy
Yeah.
and be happy and have gratitude in life and do things that give you joy, whether it's dancing, music, painting, whatever gives you joy. I
Yeah.
think at the end, joy is very important in life.
Happiness is
Happiness and love
gratitude is what
and love
seems
and
true.
gratitude. And no, I always say no one's come out of life alive, right?
Right. Yeah.
No one.
Yeah.
So don't take
Enjoy
it
it.
seriously, enjoy it, take it lightly, and make the most of it.
Lovely.
And give lots of love, receive lots of love.
Absolutely. Well, thank you so much for being here.
Thank
It's
you,
been
Kavas, for having me.
absolutely enlightening on such a simple topic. Well, breast cancer is not a simple topic,
No, but it is.
to
It
the-
could be made very simple
Exactly.
by clearing awareness.
Coming back to the awareness,
Absolutely.
to the awareness point.
Yes.
And I have to say, it has come a full circle. As I said, 50th episode. It was, we were going to probably
Yes.
have our first or second episode of
In
this podcast was
November.
going to be us, but
Yes.
I think it's much nicer on how the universe has allowed us for this to be our 50th episode. So thank you so much for
And
being
it's
here.
probably getting launched slowly on the eve of Breast Cancer Month.
Exactly.
Next month is Breast Cancer
Absolutely.
Month, so
that
that's the
ties
right
in-
time.
That ties in well. And
Ties it very well.
hopefully we'll have you back soon. And
I look forward to
talking
that.
about
Maybe
that.
come for my book and talk about
Yes,
it.
actually,
It's
yeah, that's right. We should
Maybe
probably
in
have you
October,
right
come.
when your third book is out.
And I will come.
Absolutely. So thank you so much.
Thank you,
again
Kavas,
being
for
here.
having me. Thank you.
Thank you all for being here. And before you leave, do not forget to hit the like and subscribe button before leaving today. Thank you.